साधकं कलाधरावतं सकं विलासिलोकरक्षकम् अनायकैकनायकं विनाशिदेवदैत्यकं नदाशुभाशुनाशकं नमामि तं विनायकम् नटेतरातिभीकरं नभोधिभागभास्वरं नमत्सुरारिनिर्जनं नटादिकावदुत्तरं सुरेश्वरं निधीश्वरं गजेश्वरं गणेश्वरं महेश्वरं समाश्रये परात्परं निरन्तरम् जय गणेश पाहि मां जय गणेश रक्ष मां जय गणेश पाहि मां जय गणेश श्री गणेश रक्ष मां जय गणेश रक्ष मां जय गणेश रक्ष मां.
Thank you, Dr. Nitya. We will now begin with the welcome speech by Dr. Anaesthesiology, the organizing chairman of our workshop and professor of Anaesthesiology and Critical Care, K.S Hegde.
And dear delegates, for us, K.S Hegde Medical Academy, this year is the celebration year. We are celebrating the silver jubilee of successful 25 years from 1999, and we are part of this celebration. In the Department of Anesthesia, we have contributed to the success of the medical college in achieving the highest standards, and myself being serving and observing even at state level conferences. We started initially with pediatric anesthesia. We have conducted pediatric anesthesia workshops and CMEs, and then we thought the difficult airway is the most important aspect in the management of anesthesia. We have conducted workshops and we have initiated under the leadership of our former HOD Professor Dr. Ravindra Yes. We are very happy to say that the All India Difficult Airway Association was started in this prestigious institute in the year 2010, and we have conducted the decennial conference also here. And I am very proud to say the present national president of the association is our own lady, our medical superintendent, Professor Dr. Sumalata. And now we have to go along with the development of the specialty. Ultrasound is gaining popularity in all the specialties, be it the medical specialty, surgical specialty, and we anesthesiologists are making use of it in many areas. Ultrasound could replace the STDs or the stethoscope because it is so useful. In the operation theatre we used to use, and now also we are using, but we used to use for nerve blocks, but we are additionally now using for many other things as already discussed. Is it a difficult airway? Yes, you can do it, you can assess it by ultrasound. Is the tube gone in? Yes, you can assess. If the patient is not giving a good information, is the patient fasting? Yes, you can make out whether the stomach is full. When you pass a rice tube, whether the tube is gone into the correct place? Yes, you can. When the surgeon passes a police catheter, is it in the place? You can. And like that, in each and every aspect. In addition, in the emergency room and also in the ICU, we can do e-fast. You can assess. Not that we are any replacement for radiologists, but as radiologists are always busy, we can use this expertise so that the patient is taken care with a good care as early as possible. So POCUS, that is the point of care ultrasound, in which this particular workshop we are trying to highlight and impress upon the use of ultrasound, especially in the emergency room. To inaugurate this particular workshop, we have our Vice Chancellor, Professor Dr. M.S. Moditaya. He has agreed to inaugurate this particular workshop even in spite of his busy schedule. We welcome you, sir. Our in-charge Dean, Professor Dr. J.P. Shetty, who is always a support ever since the inception of this institute. He has very much agreed to preside over the function. We welcome you, sir. Our medical superintendent, as I said, she is our own lady, and it is very proud moment for us. And she is sitting there. We welcome you, madam. I welcome the esteemed faculty for this particular workshop. We have many faculty. We have come from different part of southern India. Dr. Pankaj Kundra, he has come all the way from Pondicherry and he has already delivered a guest lecture. Professor at Digmar Pondicherry, he is the former HOD and former Dean. I was just asking yesterday, sir, are you just professor? Then he said, I am just Dean of 5 medical colleges under Pondicherry University. That is his humbleness, and we are very much indebted for you being here. He is also the immediate past president of All India Difficult Airway Association. Dr. Bal Venkat Subramaniam, for some urgent work he had to leave. He is the president-elect of our Indian Society of Anaesthesiologists, and more than that, he is the secretary of World Federation of Society of Anaesthesiologists. He is a person who has contributed a great to the specialty of anesthesia. Dr. T.A. Patil, a senior man, my good friend from my PG days. He is the director of the Department of Anesthesia at Fortis Hospitals, and he has conducted advanced perioperative TE, that is transesophageal echocardiography course from USA. We also have Dr. Mohan Bhojaraja, who is a nephrologist, who is associate professor from Kasturba Medical College in the Department of Nephrology. I welcome you, sir. Dr. Sudhir Venkatramaya, professor in the Department of Neuroanesthesiology and Neurocritical Care at NIMANS. We welcome you, sir. Madam Dr. Renuga Guragor, consultant at After Bangalore. We welcome you, madam. My good friend Dr. Muhammad Azam Danish, a very popular person. His notes, his PG notes, a good teacher he is as a postgraduate, and of course now he is one of the excellent teachers, you especially also in ultrasound training. Dr. Deepak S, consultant at Bhagavan Mahavir Jain Hospital and also IGV Superspecialty Hospital, we welcome you, sir. Dr. Garima Sharma, consultant at Manipal Hospital, we welcome you, madam. I welcome all the heads of the institutions under NITTE University, all the HODs and all the teaching faculty of all the different departments of Shema and other departments. I welcome my chief, Professor Dr. Shripad Mahendale, the organizing secretary, Dr. Rashmi, treasurer, Dr. Ranjan, and all the senior and younger faculty of the department, and also the postgraduate departments, postgraduates. I also welcome all the support staff, teaching and non-teaching staff.
very outset, let me thank the organizers of this event. As Kshema is celebrating its 25 years of meaningful existence, in every department one or the other activity is happening all through the year, and I have been the beneficiary of these events. It is always a pleasure to be with our colleagues and get to know first-hand information on what is happening with the institutions. As you know, NITTE as a university is committed to the cause of higher education, research and extension services. Kshema is one of our prominent institutions of which we are all proud of. As you celebrate the 25 years in the Silver Jubilee year, obviously it has been our aim that in every department some meaningful activity should happen. Anaesthesiology, I think I remember even earlier you had organized some programs, but some people are very enthusiastic and we wish to make use of, because in marketing we say the occasion is very important. You should, if you don't have good occasions, you should find occasions. Okay, Silver Jubilee is just an excuse, but those who are proactive, I'm sure, would organize many events, and I wish to congratulate the Anaesthesiology department for having, for leading this sort of initiative. Ladies and gentlemen, the other day when Dr. Rashmi and if I'm right, Govindraj came to me, every time whenever someone invites me, I try to understand about that field. They tried their level best to convince me about the importance of this event, and they have been especially talking about the developments happening in the field of anesthesiology, and the point of care ultrasound though is the focus. Okay, they also have been talking about the other developments happening, how artificial intelligence and machine learning is going to affect, and how many other enhanced monitoring techniques are going to affect our profession and so on. I don't know whether I am a very good student. I think even they had it out, and that's why they sent me a small note also this morning. As I opened in my mail, which I regularly do, there is a note on what's happening. But I tell you, anything without experience, if you speak, I may be in a position to speak, but these, it will be like a flower without fragrance. Whatever, when your words are immersed in experience and when you speak, like you have been, though for 5 minutes I had the opportunity to listen to Pankajji. Okay, as you were speaking, it is quite obvious that behind those words there is so much of experience, and for the youngsters it's a great opportunity, because you may get the same thing. Information you will get from the textbooks, or today it is so very easy. If you have ChatGPT in your mobile, based on your ability to pose a question, you will get wonderful answers. Okay? That's the kind of environment you are having. But I tell you, in spite of all the sources of information and the knowledge that we have, coming together like this and spending time, that would be a great experience, and the learning, the effectiveness is going to be much more than anything. I only wish to say, I have to go for another function at 10, so it's almost getting 10. I only wish to say that as professionals, I remember when we were very young in the school, there always would be, for debate, one of the themes would be, I studied in a Kannada medium school, Hanamelo Vidyamelo. The same thing translated, what is important, money or knowledge? But then again, today the same thing, if you take, in a very professional manner, you may, same thing, if it is the same question is to be rephrased, you may ask, what is important? Is it economic capital or intellectual capital? Okay? Now, but then possibly if someone today asks me, what is Hanamelo Vidyamelo, I would say, Hanamaduva Vidyamelo. Okay? Vidya could be. Now, but in professional life, this becomes very important. I know that all of you are not behind money. I know all of you are so concerned about the service to the society, service to the patients, and therefore you never look at money. But then the economics is also important for any organization and also individuals. After all, a college or a university is nothing but several people coming together. meaningful people coming together making a difference. That's why my definition for any organization would be an organization is a system of consciously coordinated activities of people. Consciously coordinated. So an organization should have a goal. An organization should have the process. An organization should have the commitment to ensure that you attain something. That's the reason, under the able guidance of our Chancellor, NITTE as a university, among the 1,100 universities of the country, we are at the 65th position. We wish that this might change from time to time, but we will be moving forward. Ladies and gentlemen, when we talk about the professional development, each one of us should ask ourselves 4 questions to be relevant, both in economic and academic sense. Question number 1. Rather, if you have to suggest someone, I will put it this way: do what you love. That is the first thing. Now, first of all, do you love what you are doing? I am sure all those who are here, otherwise you would not have come here. The second important point is, do what you are good at. You may do so many things, you may love so many things, but are you doing what you are good at? The third question is, are you doing what is needed? Okay, your services, whether it is appreciated. And finally, another very important question, would you be paid for that? That is also equally important. You may love what you are doing, you may be good in what you are doing, the world may need it, but if you are not paid for that, the economic aspect would not be taken care of. And again, I would add one more point to that again, are you continuously investing in developing yourself in what you love and what you are good at? This is a part of that, this continuous development. Let it continue, and I wish that you all would be wiser as you move out of the room by the end of the day, thanks to the wisdom that is going to be imparted by these eminent personalities who are here. I wish you all the very best, and it has been wonderful being part of this project.
K.S Hegde, who will share his perspectives with us.
Various departments of K.S Hegde Medical Academy and the directors of NITTE deemed to be university, my dear colleagues at Shema and dear delegates. As the Vice Chancellor has to move for another function, I will be giving my short note as a presiding officer. Honorable Vice Chancellor already mentioned that we are celebrating 25 years of K.S Hegde Medical Academy of its existence. As Professor Bangera said, it started in the year 99 with 300-bedded hospital of 100 MBBS admissions. Today, all of us proud to say we have 1,400 beds with the 250 MBBS intake and almost around 138 postgraduates spread about in 20 different broad specialities. There are many delegates who have joined here. This is the importance of this 25 years of celebration. In this 25 years, anesthesia, Department of Anesthesia also moved way forward. As Professor Bangera said, maybe probably the first department which instituted an oration, what is called as difficult airway management. I think 3 orations have already been over. 11 orations are already over after it's been instituted under K.S Hegde Medical Academy and NITTE University. The importance of anesthesia is very important. It was named under NMC or MCI is anesthesia, and around 8-9 years back it is renamed as Anaesthesiology. And the movement is so far now, the department has to be renamed as everybody is trying through the association, Anaesthesiology and Critical Care. So you think now the departments of anesthesia are going in different specialities. Gone are those days, the anesthesiologist was sitting in the anesthesia room and just giving anesthesia and coming out. Now there are many fields. You name anybody when you finish MD anesthesiology. Other day I was in charge D, one of the MD resident who is a senior resident came to me and said, sir, I got a neuro anesthesia fellowship in NIMATS. So this is the different branching out fellowships in anesthesiology. So I think a program like this, especially point of care ultrasound, is very important for the simple reason that I was just going through in the emergency medicine. If you take for an emergency physician, the point of care ultrasound is very important. If I am not wrong, Dr. Pankaj may rightly correct me. In case of pulmonary medicine, I think that more than the investigations, this POCUS will give more than 93%, 99% sensitivity and specificity at managing critically ill patients in the emergency care, especially people with, I think the cardiac death is a major burden. Quarter of elderly patients, especially in the rural area, they die of heart disease. I think the Professor of Anesthesia and HOD, I request them, they must take all the rural medical officers and physicians getting to this workshop, so that this ultrasound is very important for them, because there is no radiologist available. Any scan, any cardiac output, any ejection fraction, they have to travel around. By the time the patient will be no more. A workshop like this, getting all the rural physicians and the primary care health workers will be of great benefit for critically treating the patient, especially diagnosing this. I think the workshop, today's workshop, tomorrow also there is a CMP program versus the Alumni Association get together. I wish you all the best and you move forward from our campus with fruitful memories. Thank you once again.
Dr. Anaesthesiology. And also we'll be presenting the mementos to our guest secretary.
Respected dignitaries, esteemed guests, faculty members and fellow participants. On behalf of the organizing committee of Point of Care Ultrasound Workshop, I would like to express my sincere thanks to Honorable Chancellor, NITTE University, Shri N. Hegde, Pro-Chancellor, Professor Dr. M. Shantaram Shetty, and Shri K.S Hegde for being a constant support and encouragement. I would like to extend heartfelt gratitude to our Chief Guest, Professor Dr. M.S. Muditaya, our dynamic Vice Chancellor, for guiding us with his visionary leadership. Your presence is a great honor to us, sir. We are grateful to our esteemed workshop faculty members, Dr. Pankaj Kundra, sir, Professor Dr. M.S. Muditaya, sir, could you? T.A. Patil, sir, thank you for being here, sir, and guiding our delegates. Dr. Mohammad Azan Danish, sir, thank you for being here from all the way from Bangalore. I call upon Dr. Sudhir B, sir, from NIMHANS. Thank you, sir. Dr. Deepak S, intensivist from Mahavir Jain Hospital. Thank you for being here, sir. Dr. Renuka G from Aster, Bangalore. Thank you for being here, ma'am. Dr. Garima Sharma from Manipal Hospitals. And Dr. Mohan V. Bojuraj from KMC, Bangalore. KMC Manipal, sir. I would also like to thank Professor Dr. Jayaprakash Shetty K, in charge Dean, Shema, for agreeing to preside over this function. Your guidance and support mean a lot to us, sir. Our own Professor Dr. Suma Shetty, Medical Superintendent, Justice K.S Hegde, Chairman of the Hospital, we appreciate your gracious presence and continued support to our institution and department. I would also like to thank Professor Dr. Shripad Ji Mahendale, HOD Department of Anaesthesiology, for being instrumental in ideation and execution of this workshop. I thank Professor Dr. Anand Bangera, Department of Anaesthesiology, organizing chairman of this workshop, for sharing his wisdom and guiding through minute detailing. Special thanks to Skill Lab team led by Dr. Gayatri Bhatt for their cooperation in realization of this workshop. I would also like to extend a special thanks to senior professors, colleagues and residents from Department of Anaesthesiology, Chema, who have been an integral part of this journey. Your ideas, suggestions and support have been invaluable in making this workshop a success. I thank all the HODs and staff of Chema for being here at the inaugural ceremony in spite of their busy schedule. Most importantly, I thank all the delegates who are participating in this workshop from near and far off places, including different states. We would like to express our gratitude to Neon, BPL, Microlabs, Lupin Pharma, Raymond Phillips GE Sonosite who are equipment providers who have supported us with their expertise and resources. Your contribution has been crucial in making this workshop a success. I would like to place it on record by thanking our caterers, audiovisual team, electronic and print media. Finally, I would like to thank our office assistants and support staff led by Mr. Anil, who have helped us in so many ways throughout this process.